You're not gonna do it? Come on. Just one time. He loves music and books. Don't you? You do. So I remember right before I was went to sleep, I was just praying, and I was like, God, please don't let me wake up to bad news about my baby. It was just a huge blessing because, I've never met these people before. This is my first child, and they were like family.
What would you say to one of the nurses if they were here now?
Stop.
Why'd you hold that? Because there is one over here.
Oh.
Hey, how are you? Good. Hi, Brax.
So what was I saying? What would you say to one of the nurses if they were here?
I would just say thank you. I wasn't gonna do this. I know that you were just doing your job, so to speak, but you gave me everything.
Hello everyone, welcome out to Fairview Park Hospital. We're here with Dr. George Harrison. Been on before with us many times. Thank you for taking time today. I've been out to the hospital, ladies and gentlemen, a few times lately, and it seems like everyone's always in a meeting or in between meetings. We have one coming up. Because the safety of our community is at hand, and you all have to have strategic plans. Many people wonder after the press conference yesterday, from the governor and trying to put everything out there, should there be a state of emergency, what's going on? But a lot of people don't realize, Doctor, and I'm sure you can expand on this, that the medical industry always has a plan for a pandemic outbreak. There's always a plan. You may not know what that outbreak may be, but you do have a plan.
Yes, correct. And with this pandemic, like many others, the plan is usually drilled. We go through a series of drills here at Fairview Park and have been corporation-wide. And our corporation is Hospital Corporation of America. So let's first talk about the coronavirus, what it is and what is a pandemic, because a lot of people may be confused on the terms or why all of this emotion and why all this hysteria that is perceived to be out there now, why is it going on? Well, coronaviruses, they are a large group of viruses that have been around for centuries, and they affect multiple species of animals, including humans. And typically they're caused like a common cold. And we've had this and we've experienced this for many years, but every now and then you will have a mutation, and that mutation can come from one animal into humans, and it can cause a very severe lower respiratory tract illness. You probably remember the MERS epidemic that occurred a few years ago. That jumped from camels. And before that, there was a SARS epidemic which occurred in China, which we don't know if it came from chicken or bats or something of the sort, but it jumped from them into humans and it caused severe disease. This one, we believe, came from bats or pangolins. Pangolin is a prehistoric looking creature, and it has also jumped to humans, but it is causing severe respiratory disease in individuals who usually are sick from something else. So say, for instance, you have a diabetic patient or a patient who is immunosuppressed from like lupus or one of these other autoimmune diseases. It can get down into their respiratory tract, cause a very severe pneumonia. It can even result in death, as we've seen around the world. So let's explain the term pandemic as opposed to an epidemic. When we think of disease states and how they affect a population of people, epidemics are contained, they're within one geographic area, a location, and it has a high amount of activity in that one location. Pandemic means that that same disease process has gone worldwide. So the WHO, the World Health Organization, is responsible for deeming whether something is a pandemic or an epidemic, and this has officially been labeled a pandemic.
Yeah. And when we first heard about it, well, gosh, it's been a couple of months that the illness had an outbreak, and we feared that it would make it to the United States. It indeed has.
Yes.
In many cases over the United States, but here in the state of Georgia, I think it's a little over 40 right now.
That's right. That's right. We have not been able to test as much as we would like to. The governor, as well as the president, most of us in the medical community realize that when pandemics occur, our best defense is to not allow people to huddle, to practice safe hygiene measures, meaning hand washing, meaning avoiding people when they're sick, meaning reporting symptoms right away to your PCP or primary care physician. That limitation of tests has left us pretty vulnerable. Because we haven't been able to test the masses, we don't know where this is. We don't know how large the outbreak is. And the best defense we can have right now is to avoid each other, and definitely to avoid areas where this disease is endemic.
Yeah, social distance has been displayed many times
Absolutely.
over the last few days, and everyone needs to adhere to that. Many of us will want to go to a social event, will want to go to church, and
Yep.
If your church is holding a service, that's a decision you have to make.
It
But
is.
We should really, doctor, follow guidelines that are so very basic. If you don't feel well, if you're prone to illness, and
Yes.
you have some type of respiratory problem,
Yes.
or history of that, stay at home.
Stay at home, please. We see a lot of people here that are very sick from other maladies, whether it's a heart attack or a stroke. And we don't want to expose those folks to our employees, let alone visitors who are feeling ill, because if they were to contract something from someone who may be passing by in the hall and they sneeze it toward the room, and those droplets get onto something and get into that patient, just think someone's mom or dad or brother or sister that may be, in trying to get over something that significantly affected them, then that disease could get into their system and cause some serious compromise. So when in doubt, when you feel ill, the best decision you could make is to stay at home. But if you have to go out, then by all means, use hand hygiene measures extensively. What I mean is wash your hands with soap and water for at least 20 seconds. And throughout the day, you want to use hand gels, hand sanitizer, to make sure your hands are getting cleaned appropriately. If you see someone that is ill, that looks ill, that nose is running, say they look a little feverish, you want to stay at least 3 feet away, 6 feet in some areas if you can. It's best to do a lot of outdoor activities with the family and not huddle like enclosed events like a indoor arena, a ball game, because germs just populate in those type of activities.
Mm-hmm. And doctor, when we think about people who may not be feeling well, who may have some respiratory, and it may feel like it's lower respiratory, and
Yes.
they have other symptoms, flu-like symptoms, should they just show up at the hospital or doctor's office, or isn't there a measure so that they keep other people safe that we should follow?
Absolutely. What the CDC has guided us to do, if you feel as if you've been exposed to this disease, or you're coming from an area where this disease is prevalent, they've recommended that you contact 1-866-PUB-HEALTH, PUBHLTH. That's our public health department service. And what they'll do is they'll walk you through a system of questions and determine whether or not you're someone who should be quarantined or self-isolated, or versus someone who should do that and get testing. If the risk is high enough, they're going to recommend that you do get tested. And in the early stages of this, being last week, there was a plan to send folks out to the homes to get them tested. I think it's being modified now, but that they will walk you through that process. When it comes to, if you're feeling really bad, you have a fever and cough and or shortness of breath, and you feel like you need to be evaluated, if you need to go to your physician's office, I advise you to call first. Please give them a call and say, explain what your symptoms are, so they'll be prepared, because we want to protect the doctors and their staffs too. So give them a call and explain what your symptoms are, and they will guide you from there to either come in the back entrance and get a mask, or no, your illness is a little beyond what I can treat in my office. I'm going to need you to go to the emergency room. And so when you do show up in the emergency room, here at Fairview Park, we've implemented a process where we're screening visitors as well as folks who come in on a routine basis to get treatment. And we ask a series of questions, and if you flag for these questions, then we will get you to the appropriate help. If you are a visitor and say your questions are negative, then we will let you visit your loved one. But if you have a fever, you have a cough and or shortness of breath, or you've had travel to one of these areas or been exposed to somebody with COVID-19, again, we don't want to risk our patients and our staff. We would love for you to go and isolate yourself at home, contact the public health department, and let them guide you to the right decision.
Doctor, when you talk about isolating oneself, if you're not feeling well, if you think you may have contacted it, and it's difficult to do when you have limited resources.
Yes.
When you're in a home and there's 5 or 6 and you have one bathroom and you have one person that's feeling like they may have the issue. You just have to make the best of that situation, don't you?
You certainly do. There's no absolute way or best way to do it because everybody's situation is different, right? If I could control that situation, I would love for you to have a bedroom with an associated bathroom, and you monitor yourself within that confined space for 14 days to see if symptoms presented themselves. Of course, you would have access to food, or someone could bring you food, but we would not want you going into the public arena. It's appropriate to go outside, to get some fresh air, but we would not want you cohorting or associating with other folks in close proximity, because if you were, like say, on the 5th day, if you started to develop symptoms, then guess what? That virus, and if it's the virus, it will start shedding, and you would share what you have with your loved ones.
And again, cleanliness is paramount.
Cleanliness is paramount. There are a lot of recommended cleaners when it comes to people who've had viruses like, say, the flu or, say, COVID-19. Clorox does a really good job. Lysol wipes, they have been recommended and approved. But making sure that if a person who's experienced the flu or some other virus like this, you wipe down the surfaces where they have been, because if they were to cough or sneeze, it could live on those surfaces for several hours or days.
Yeah. Dr. Harrison, it's been said that healthy people could be carriers.
Absolutely. I want to stress that the majority of people that will contract this disease will live. Right now, we're seeing about 97, 98% of the people who have actually had the coronavirus and lived through it. With a lot of folks, it's a common cold. With some people, you might not feel any symptoms whatsoever, but you could carry the disease and you could shed it. Now, a small percentage of those people, let's say 2 to 3%, get really, really sick and do not make it through it. Unfortunately, most of the people who succumb to this disease were over the age of 65, and they usually have other illnesses, other immune deficiency illnesses, or diseases that would cause the immune system to not work right, that leads to this lower respiratory tract illness. But you very well may not have any symptoms at all, but you could still test positive for this disease.
Yeah. And so let's talk about the number that can be tested that was presented by the governor. I think it was 50 that can be tested per day at this point with the system that we have in hand.
Yes.
And what plans the medical industry has to ramp that up.
Absolutely. Thanks for that question. Well, one of the things, and I think Dr. Fauci with the CDC has advocated and actually put forth that we need more testing. He recognizes that one of the deficiencies we have in counteracting or combating this disease is the lack of available tests. And we are trying to ramp up the number of tests as a country to make sure people are adequately tested so that they could get, referred to appropriate treatment. I did hear the governor say that there were about 50 in the state of Georgia, and this is coming through the Department of Public Health from the CDC that can be tested in a day. So the way public health partners with the hospital, they would like us to identify any persons who are suspicious for the disease or who at high risk for having this disease. They become what we consider a person under investigation and just investigation of the disease. And what that just tells us is like, hey, they have the circumstances, the symptoms that are ripe to have this disease process, so we should be looking for it. And we run a series of panels of tests, and you're registered with the public health department, and that test goes off, they test for it, and they give us the result. Okay. Now, there are other instances where you could be tested as well. Laboratory companies like Laboratory Corporation of America, LabCorp, as most people know it, Quest, they have developed their own testing paradigms, and we could actually get swabs, or hospitals across the nation could get swabs and send it out through some of these third-party labs, and they could test for the virus as well. In fact, the public health department has been so overrun with the number of tests to be done, they have requested that LabCorp and Quest and some of these other agencies use their resources to kind of help them to test and track for this disease.
So it would be probable there'd be even more to come along and help private entities
Yes.
come along and try to help.
Absolutely, absolutely. I think that that is going to be the answer to fighting this pandemic. I mean, we're doing the things that we medical scientists know to do, which is to avoid each other, avoid people who are sick, do general hygiene measures. If you are feeling sick, to stay at home, do not come into the public arena. And while we're doing avoidance, the healthcare industry is steady trying to ramp up the number of tests so that we could get people appropriately tested and to the adequate treatment facilities.
And Doctor, if you would just reiterate the care of senior adults and how to go about that, as well as those that might be high risk from prior health issues.
Yes. So senior adults are the ones who are the most vulnerable from having very serious complications of this disease, just as they're the most vulnerable population for having complications from flu, influenza. The best thing we can do for our seniors, by all means, if we're feeling ill, if we're feeling sick by any circumstance, we should probably not visit them at that point. You know, we have wonderful devices now, iPads, iPhones, Samsung devices or Android devices where we could FaceTime. You know, it's okay to FaceTime grandma, auntie, or grandpa. That is a better option than to go and visit them and risk giving them a virus or disease process that could be pretty disabling or really threaten their life.
Yeah, detrimental to someone in that
Very
that
detrimental.
stage of life. Doctor, in staying abreast of everything, is there any promise of a vaccine that may be coming, or any kind of timeline on that, or is it still just in the works?
It's still in the works. What I read not so very long ago, in China, you know, this disease process started there as the epicenter, and that's where we first saw the first cases. At that point, the public health experts start looking at ways to culture the disease and generate vaccines. We have been working with them as well, and we've gone through the phase 1 trials. There are about 3 phases to get a vaccine from experimental stage into the public arena. And we're in phase 1 trials now. The next 2 phases would probably take at least another 8 months or so. So we're thinking by next year we should have a vaccine against this particular strain.
Yeah, are we still real positive that warmer weather will dissipate it?
It's unknown. We think that it would be like most viruses, and then once the weather warms up and the sunlight is more consistent, then those viral particles don't live on substances very long, and that's what really does it. You know, if someone does sneeze or they do cough, and you happen to be outside or you happen to be in an area that's getting a lot of sunlight, it dehydrates the viral particles, or better yet, the heat from being outside disintegrates it, and it's less of a transmission risk.
So good to get outside.
It's good to get outside.
We thank you for what you do here at Fairview Park and for the knowledge that you can give to people, our viewers, so that they wouldn't worry as much, but follow the guidelines. It's basic. If you'll adhere to it, it'll help things. There's the 14 days. There's the 2 weeks. Students who traveled outside of the area and coming back into different university system,
Yes.
Georgia, colleges, they've been told to self-isolate
That's right.
themselves. So, there's that 14 days. It'll show up in that amount of time is what's being presented, right?
Absolutely, you're correct. So the longest period of record, we call that the incubation period, has lasted somewhere around 9, roughly 12 days. 14 is a good measure that if you were exposed to this disease and you were active with this disease and was going to have symptoms, you would probably have them within the 14-day stretch. So we set the bar at 14 and say, hey, if you're traveling traveling from one of these areas and you start experiencing symptoms, you should see them within the first 14. But it's a good bet that after 14 days, if you haven't experienced anything, you probably are not contagious. You probably did not contract the disease.
Okay. Good information for you, ladies and gentlemen. You can go on the website for Fairview Park Hospital. If there's a need, you can call and get medical attention that you need as always here. Once again, Dr. Harrison, thank you for your time. Thank you for what you do at Fairview Park.
And thank you, Dublin community.